Stand up right now. Go ahead. Pay attention to what just happened in your body while you were sitting there. Your heart is beating, your blood is flowing, and your arteries are quietly doing their job. But here's something most people don't know. After age 55, your arteries aren't as strong as they used to be. Many people think clogged arteries happen all at once. One day you're okay, and the next you have a heart attack or stroke. But that's not true. Clogged arteries build up slowly, quietly, over many years. There are no loud warnings, no pain, no clear signs until one day something big happens. A heart attack, a stroke, or a doctor tells you, "I wish we had found this earlier." I'm doctor, and for many years, I've helped older adults keep their hearts healthy in natural ways. What if I told you there's one easy meal, not a pill, not surgery, that science says can help your body protect your arteries starting with your next meal? And no, this isn't a strict diet. It's not costly, and you don't have to stop eating all the foods you like. Stay with me because by the end of this video, you'll know exactly what to eat, why it helps your body, and how to do it safely, especially if you're over 60. But first, I need to fix a common wrong idea. When people hear clogged arteries, they often think of pipes full of grease. That's only part of it. The real problem starts with inflammation in the arteries. Ongoing inflammation hurts the inside lining of your arteries. Once it's damaged, cholesterol sticks to those spots. Calcium builds up on top, and slowly the arteries get stiff and blood can't flow well. This is called atherosclerosis, and it happens quietly over many years. Here's the key thing: your body can fight back. You can slow this down. You can even reverse some of it, but only if you stop adding to the inflammation that causes the damage. That's where this meal comes in. Before we go on, leave a comment with just your age. I'd like to see who's working on their heart health today. Let me tell you what's really going on in your body that no one talks about. When you reach your 60s and 70s, your body goes through 4 big changes that affect your arteries directly. First, ongoing inflammation in the arteries. Think of your arteries like a garden hose. When the inside is smooth, blood flows easily. But ongoing inflammation makes that lining rough, like moss inside the hose, making blood flow bumpy. In medical terms, the artery lining is the endothelium. When it's inflamed, cholesterol and calcium stick easier, forming plaque. Researchers at Harvard studied over 5,000 adults for 15 years and found that higher inflammation signs predicted plaque growth better than cholesterol levels alone. I know you might doubt this. You've heard to eat low-fat, take statins, or skip red meat. But those things alone don't fix the root inflammation. Next is oxidative stress and unstable plaque. Here's why this is hard. Plaque isn't all the same. Some is soft and shaky. Imagine a thin ice layer over water. A little push can crack it. That's like unstable plaque. It breaks and causes heart attacks or strokes. Oxidative stress, basically damage from free radicals, makes the plaque's outer layer weak. A study from Johns Hopkins followed 2,400 older adults and found that those with more antioxidants had 52% less risk of plaque breaking. The third change is less nitric oxide being made. Nitric oxide is a molecule that helps your blood vessels relax and open up. Think of it as oil for a door hinge. As we get older, less is produced, arteries get stiff, and blood pressure goes up. Researchers at the University of Barcelona showed that just 4 weeks of a Mediterranean-type diet raised nitric oxide levels by 30%, making arteries more flexible. Finally, blood sugar jumps and insulin resistance. Many older people don't think much about blood sugar spikes after eating. Imagine your arteries like carpet threads. Every spike is like spilling soda on the threads, small damage that adds up. High blood sugar causes insulin to come out, which adds to inflammation and hurts the endothelium more. If you've had tingling in your feet, tiredness after meals, or higher blood pressure, add the word artery to your comment now. Now, here's where most people make a mistake. They only worry about cholesterol. Yes, LDL is important, but inflammation, oxidative stress, and problems with the endothelium are just as big or bigger. That's why going after the cause, ongoing inflammation and oxidative stress, is much better than just watching numbers. We've talked about how arteries get damaged. Next, I'll show you how easy food choices can protect, heal, and even partly reverse this damage. Let's make this real with stories from actual patients. Margaret, 67, came to me concerned. She had a family history of heart issues, and a recent ultrasound showed early plaque. She said, "I feel okay, so why is this?" Her blood pressure was 146/88. Cholesterol was on the edge, but inflammation signs were high. We started what I call the heart protocol, a plan for eating and living that targets inflammation, oxidative stress, and blood sugar control. In 8 weeks, her blood pressure went to 128/78, her CRP, inflammation marker, dropped 36%, and she felt more energy and clear thinking. She said, "I didn't know I could feel this good again." George, 72, had been on a low-fat, low-cholesterol diet for 20 years, thinking he was safe, but his recent CT scan showed plaque getting worse. He was upset. Sitting with me, he said, "I've done everything right, and still this." We changed his meals to a Mediterranean style, focusing on inflammation. 2 months later, another scan showed plaque stable. His triglycerides fell from 220 to 160 mg/dL, and HDL, good cholesterol, rose 15%. Most important, he felt confident again, knowing he was helping his arteries. These stories aren't rare. Years of research from places like the Mayo Clinic, Harvard, and Barcelona show that older adults who eat anti-inflammatory meals with omega-3s, colorful veggies, and olive oil see real improvements in artery health. Now, I'm going to teach you the exact meal plan Margaret and George used, step by step, so you can start it safely today. Let's get into the heart protocol, a simple 5-step system to feed, protect, and support your arteries. Step 5. Fatty fish. Base it on salmon, sardines, mackerel, or anchovies. 2 servings a week give real heart benefits. Omega-3s lower artery inflammation, boost nitric oxide, and stop platelets from clumping. A 2018 study in the American Journal of Clinical Nutrition showed 380% better artery flexibility after 12 weeks of steady omega-3s. If you don't like fish, think about good clean fish oil pills, but always talk to your doctor, especially if on blood thinners. Step 4. Colorful, non-starchy vegetables, like spinach, arugula, broccoli, red peppers, tomatoes, onions, full of polyphenols, flavonoids, and fiber. Fiber grabs extra cholesterol and controls blood sugar jumps. Polyphenols cut oxidative stress. Harvard researchers followed 3,000 adults for 10 years. Those eating at least 5 servings a day had 42% less artery stiffness. Mix colors and aim for 3 to 5 cups daily. Raw or lightly steamed keeps the antioxidants. Step 3. Extra virgin olive oil. Has oleic acid and antioxidants like hydroxytyrosol. Protects the endothelium and stops LDL from oxidizing. Use it as a drizzle on cooked veggies or fish. Choose cold-pressed, in dark glass, kept away from light. Don't use high heat to keep the good stuff. Step 2. Natural flavors like garlic, turmeric, black pepper, lemon juice, oregano, and rosemary. Garlic lowers blood pressure and artery stiffness. Turmeric stops inflammation paths. 1 or 2 crushed garlic cloves a day can drop CRP by 20–30% in older adults over 12 weeks. Step 1. Stay away from things that cause inflammation. Refined carbs and some vegetable oils, like soybean, corn, sunflower, canola, start inflammation that cancels the good from other steps. Switch refined carbs to whole, less processed ones. Change those oils to olive or avocado oil. Remember, pills can't fix bad eating. It's like fixing a roof while rain keeps coming in. When you do these 5 steps regularly, arteries have less inflammation, better flexibility, improved blood flow, and more stable plaque. This isn't a quick fix. It's a steady way of eating against inflammation that builds over time. So, what happens when you begin this protocol? In week 1, you might see small changes: a bit lower blood pressure, less tiredness after meals, better digestion. By week 2, inflammation signs start dropping, blood sugar jumps are smaller, and energy stays even. Weeks 3 to 4 bring clear improvements. Blood pressure goes down more, cholesterol acts better, blood vessels respond better. From week 4 on, the structure gets better. Plaque stays stable, arteries get more flexible, and risk of breaking drops. This is a building, protective change that, over months, makes a real difference in heart strength. Now, let's be clear on safety. This protocol isn't a cure for heart disease. Never stop your medicines without your doctor's okay. If you take blood thinners, talk to your doctor before adding more omega-3s or garlic. If you have kidney problems or are on low-potassium diet, check before eating lots of leafy greens. Start slow. Your body will get used to it, then add more types and amounts as you can. Safety comes first. Think of this as extra help that works with, not instead of, your medical care. Here's my challenge. Choose one part of this protocol, maybe 2 servings of fatty fish a week or adding olive oil to veggies, and stick to it for 30 days. Then come back to this video and comment what happened. Did your energy get better? Did blood pressure drop? Your story could help thousands of older adults watching now. Remember, your arteries have kept you going for years. They deserve better than just getting old. Feed them, protect them, and let them heal, even in later years. If this video helped, subscribe now. Next week, we'll talk about the one nutrient most older people lack that quietly makes heart health worse, and I promise at least one fact will surprise you. Stand up right now. Go ahead. Notice what just happened while you were sitting there. Your heart is beating, your blood is flowing, and your arteries are silently working to keep you alive. Most people think clogged arteries happen suddenly. One day you're fine, the next, a heart attack or stroke strikes. But in reality, clogged arteries develop slowly, over decades. There are no alarms, no pain, and often no warning signs, until a life-changing event occurs. I'm Dr. Michael Kent, and for decades I've helped older adults protect their heart health naturally. What if I told you there is one simple meal, not a pill, not a procedure, that science shows can support your arteries starting as soon as your next meal? This isn't an extreme diet. It's not expensive. You don't have to give up everything you enjoy eating. By the end of this video, you'll know exactly what to eat, why it works, and how to use it safely, especially if you're over 60. Before we dive in, drop a comment with your age. I want to see who's ready to take control of their heart health today. When people hear clogged arteries, they often imagine grease-filled pipes. That's only part of the picture. The real culprit is arterial inflammation. Chronic inflammation damages the inner lining of your arteries. Once injured, cholesterol sticks to these areas, calcium deposits form, and over time, arteries stiffen and blood flow is restricted. This process, called atherosclerosis, develops silently. The good news is, your body isn't powerless. You can slow this process and partially reverse it, but only if you stop feeding the inflammation that drives it. Here's what happens in your body as you age. First, chronic arterial inflammation. Picture your arteries like a garden hose. When smooth, blood flows freely. When inflamed, the lining becomes rough, blood flow becomes turbulent, and plaque begins forming. Researchers at Harvard followed 5,000 adults for 15 years and found that inflammation markers predicted plaque progression more accurately than cholesterol alone. Many seniors are surprised to learn that low-fat diets or statins alone don't address this root cause. Next, oxidative stress and plaque instability. Plaque isn't uniform. Some deposits are soft and unstable. Imagine thin ice over water. One wrong step can break it. Free radical damage weakens plaque, increasing the risk of rupture, which triggers heart attacks or strokes. Johns Hopkins researchers found seniors with higher antioxidant intake had 52% less plaque rupture risk. Third, reduced nitric oxide production. Nitric oxide allows arteries to relax and widen. Think of it as oil in a hinge. As we age, production declines, arteries stiffen, and blood pressure rises. University of Barcelona researchers showed that just 4 weeks on a Mediterranean-style diet increased nitric oxide levels by 30%, improving arterial flexibility. Finally, blood sugar spikes and insulin resistance. Post-meal blood sugar surges act like pouring soda on carpet fibers, tiny damage accumulating over time. Insulin spikes trigger inflammation, further harming the arterial lining. If you've experienced tingling in your feet, fatigue after meals, or rising blood pressure, add artery to your comment right now. Most people focus on cholesterol, but inflammation, oxidative stress, and endothelial dysfunction are equally important. Targeting the cause, not just the numbers, is far more effective. Now let's bring this to life with real patient stories. Margaret, 67, came to me worried. Her ultrasound showed early plaque buildup despite feeling fine. Blood pressure was 146/88, cholesterol borderline, and inflammation markers high. We implemented the HEART protocol, focusing on reducing inflammation, oxidative stress, and blood sugar spikes. Within 8 weeks, her blood pressure dropped to 128/78, CRP fell 36%, and she reported higher energy and mental clarity. She said, "I didn't realize I could feel this good again." George, 72, followed a low-fat diet for 20 years but still had moderate plaque progression. Sitting across from me, he admitted, "I've been doing everything right, and still this." After shifting to the Mediterranean-style inflammation-focused diet, 2 months later, repeat scans showed stabilized plaque. Triglycerides dropped from 220 to 160 mg/dL, and HDL increased by 15%. Most importantly, he regained confidence in managing his health. Decades of research from Mayo Clinic, Harvard, and Barcelona support that seniors who consistently eat anti-inflammatory meals rich in omega-3s, colorful vegetables, and olive oil experience measurable improvements in arterial health. Here's how the HEART protocol works. Step 5. Fatty fish. Salmon, sardines, mackerel, or anchovies. 2 servings per week provide measurable cardiovascular benefits. Omega-3s reduce arterial inflammation, improve nitric oxide, and prevent platelet clumping. The American Journal of Clinical Nutrition found 380% improvement in arterial flexibility after 12 weeks of consistent omega-3 intake. If fish isn't appealing, high-quality fish oil capsules are an option, but consult your doctor, especially if taking blood thinners. Step 4. Colorful, non-starchy vegetables. Spinach, arugula, broccoli, red peppers, tomatoes, onions. Rich in fiber and plant compounds, they bind excess cholesterol and regulate blood sugar, reducing inflammation. Harvard tracked 3,000 adults over 10 years. Those consuming 5 or more servings daily had 42% lower arterial stiffness. Aim for 3 to 5 cups daily, raw or lightly steamed. Step 3. Extra virgin olive oil. Contains oleic acid and antioxidants like hydroxytyrosol. Protects the endothelium and prevents LDL oxidation. Use as a finishing oil on cooked vegetables or fish. Choose cold-pressed oil in dark glass. Avoid high heat. Step 2. Natural flavor enhancers. Garlic, turmeric, black pepper, lemon juice, oregano, rosemary. Garlic alone can reduce CRP by 20–30% over 12 weeks. Turmeric inhibits inflammatory pathways. These ingredients enhance flavor while supporting arteries. Step 1. Avoid inflammatory triggers. Refined carbs and certain vegetable oils, soybean, corn, sunflower, canola, can trigger inflammation that cancels out benefits from other steps. Swap them for whole foods and healthy oils like olive or avocado. Supplements alone cannot override poor dietary choices. When you combine these 5 steps consistently, arteries experience less inflammation, improved flexibility, better blood flow, and more stable plaque. This is not an overnight fix. It's a rhythm of anti-inflammatory eating that builds over weeks and months. Week 1 may bring subtle improvements: lower blood pressure, less post-meal fatigue, better digestion. Week 2, inflammation markers drop, blood sugar spikes lessen, and energy stabilizes. Weeks 3 to 4 bring noticeable improvements in cholesterol particle behavior and vascular responsiveness. Week 4 and beyond, structural changes begin. Plaque stabilizes, arteries become more flexible, and risk of rupture declines. Precautions are important. This protocol is not a cure for heart disease. Never stop prescribed medications without your doctor's approval. If you take blood thinners, have kidney disease, or follow a potassium-restricted diet, consult your physician before making significant dietary changes. Start gradually, let your body adapt, then increase servings. Safety is key. Think of this as supportive care that works alongside, not instead of, medical treatment. Here's my challenge. Pick one element of this protocol, maybe adding 2 servings of fatty fish per week, or drizzling olive oil on vegetables, and commit to it for 30 days. Then return and comment with your results. Your feedback may help thousands of seniors watching. Remember, your arteries have carried you through decades of life. Nourish them, protect them, and give them the chance to heal, even later in life. If you found this helpful, subscribe now. Next week, we'll cover the nutrient most seniors are deficient in that silently worsens heart health, and I guarantee at least one fact will surprise you. Here's how the heart protocol works. Step 5. Fatty fish: salmon, sardines, mackerel, anchovies. 2 servings per week provide measurable cardiovascular benefits. Omega-3s reduce inflammation, improve nitric oxide, and prevent platelet clumping. The American Journal of Clinical Nutrition found 380% improvement in arterial flexibility after 12 weeks. Fish isn't appealing? High-quality fish oil capsules are an option. Just check with your doctor, especially if you're on blood thinners. Step 4. Colorful, non-starchy vegetables: spinach, arugula, broccoli, red peppers, tomatoes, onions. Fiber binds excess cholesterol, regulates blood sugar, and reduces inflammation. Polyphenols reduce oxidative stress. Harvard researchers tracked 3,000 adults for 10 years. Those consuming 5 or more servings daily had 42% lower arterial stiffness. Aim for 3 to 5 cups daily, raw or lightly steamed. Step 3. Extra virgin olive oil, rich in oleic acid and antioxidants like hydroxytyrosol, protects the endothelium and prevents LDL oxidation. Use as a finishing oil. Cold-pressed, stored in dark glass. Avoid high heat to preserve benefits. Step 2. Natural flavor enhancers: garlic, turmeric, black pepper, lemon juice, oregano, rosemary. Garlic alone can reduce CRP by 20–30% over 12 weeks. Turmeric blocks inflammatory pathways. These enhance flavor and support your arteries. Step 1. Avoid inflammatory triggers. Refined carbs and certain vegetable oils, soybean, corn, sunflower, canola, fuel inflammation and undue progress. Replace with whole foods and healthy oils like olive or avocado. Supplements cannot outrun poor diet choices. Think of patching a roof while water keeps pouring in. Follow these 5 steps consistently. Week 1. Subtle changes: slightly lower blood pressure, better digestion, more energy. Week 2. Inflammation drops, blood sugar spikes lessen, energy stabilizes. Weeks 3 to 4. Noticeable improvements in cholesterol particle behavior and vascular responsiveness. Week 4 and beyond. Structural benefits: plaque stabilizes, arteries become more flexible, risk of rupture declines. Precautions: this is not a cure for heart disease. Never stop medications without your doctor's approval. Blood thinners, kidney disease, potassium restrictions, check first. Start gradually. Let your body adapt. Safety is key. Here's my challenge. Pick one element, maybe 2 servings of fatty fish a week, or drizzling olive oil on vegetables, and commit to it for 30 days. Then come back and comment with your results. Your feedback may help thousands of seniors watching. Remember, your arteries have carried you through decades. They deserve more than being written off as just getting old. Nourish, protect, and give them the chance to heal, even later in life. If you found this helpful, subscribe now. Next week, we'll cover the nutrient. Most seniors are deficient in that silently worsens heart health, and I guarantee at least one fact will surprise you. Finally, if you watched all the way through, type "Heartstrong" in the comments. Let's create a community of seniors taking control of cardiovascular health. I'm Doctor, and I'll see you in the next video.